Hi folks, this is Dr. Rob Cywes. I am the CarbAddictionDoc, and today we're going to talk about blood work. Blood work. And every doctor out there is obsessed with blood work, but more and more, the healthcare system, with the influence of pharma, with the absence of asking the question why, we've shifted, and we do blood work more and more as a fishing expedition to find numbers to throw medication at. So the most important numbers that we focus on are numbers outside of some normal value that was created on a bunch of people on the standard American diet, be that as it may. We're looking at blood work, and we only look at specific numbers that we have a pill for. And we've stopped asking why. Why is this number out of line? What is going on with this patient? And is there perhaps a causal aspect that we can identify, discuss with the patient, where perhaps they can change why they have this abnormal number instead of throwing a medication at it? And we've also stopped asking the question, why is there a pill for this number, and does the pill fix the number? So, for example, just a horrible rabbit hole that our society's gone down is the lipoprotein called LDL. LDL, low-density lipoprotein. And LDL has become this fixation number. And the American Cardiology Association, now the American Diabetes Association, have got all these guidelines and regulations to treat that one number. Nobody asks why the hell is the number low. But I love what pharmaceutical company has done with LDL. What they've done is they've focused the treatment of a number, and they've given paradigms of that number. And they then allow people, you the patient, the doctor, to make the assumption that lowering the LDL, irrespective of anything else going on with that patient, is going to benefit them from a cardiovascular risk perspective. Risk of a heart attack, risk of a stroke. None of them say that because they don't have the evidence. You don't think a pharmaceutical company is going to say, hey, lower your risk of a heart attack by this amount. No, they say lower your LDL. Just like they say for the diabetic medication, lower your A1C. And they allow you to make assumptions about improvements in your health because the medicine doesn't support that. I use blood work to step backwards and see what's going on biologically within a patient. So let me give you my standard blood work. And I like to do my blood work early morning fasted. Early morning fasted when the glucagon cortisol effect is at its highest. Because that's when the abnormalities are going to be visible, and they haven't been influenced, hopefully, by at least 8 to 10 hours of not eating. So the first number I look at, and it's a global test, and these are markers. I'm looking for markers, not absolute numbers. I'm looking for a pattern. I'm looking to understand how to help you at a root cause level to address why some of these markers are off and to at least understand what influence they have on your health. So the first global marker I look at is your CBC, or your complete blood count, which is a measure of the blood elements within the blood cells within your blood vessels. I look at the hemoglobin, and then I look at the size and shape of your red blood cells that come from MCV, MCHC, MCH. That gives me a clue as to how healthy your bone marrow is in terms of producing healthy red blood cells. A little bit of genetic information, talks about your spleen as well, which is the graveyard for your red blood cells. And it gives me a clue as to iron, folate, B12, some of the minerals and vitamins that are required to make healthy red blood cells. So the hemoglobin, the hematocrit, and the shape of your red blood cells is of great value as we do this interpretation. We then look at your platelet number, and I cannot tell whether those platelets are activated or not, but I want to see a healthy platelet response. Not too high, not too low. And especially if you're on blood thinners and that kind of thing, I'd like to know where that is. And if you don't have a spleen, I'd like to know how high those numbers are, because they can also cause some clotting. The next set of numbers I look at is your white blood cell count. And your absolute white blood cell count is important to me as a global marker of inflammation. And then we look at the breakdown products. Could this possibly be a parasitic infection in your intestine? Are your eosinophils high? Are your basophils high? Could this be a histamine type response? Do you have an acute infectious response with neutrophils? So I look at how ramped up your white blood cell counts are as a global marker of inflammation. Nothing specific, but it lends a little bit of ideology regarding global inflammation, because ultimately that is your immune system in large part, or at least giving us markers and clues of your immune system. The next set of blood is your blood chemistry, and really more so I look at this. It's less important for me, but I look at it just to make sure nothing's off. We look at potassium, we look at sodium, we look at electrolytes. They're almost never off. They're almost never off, folks, because the human body is designed to preserve those numbers in a very, very, very tight, specific range. And if your sodium and your potassium are off within that range, it's usually a marker of a very, very serious acute problem. And we have to figure that out. So I glance at those. I glance at your proteins and your globulins and your albumins and your prealbumins as a marker of liver function and as a marker of adequate protein consumption. But again, they're very, very rarely off in most people. But again, the interaction matters to me, so I do look at those. The next big series of numbers I look at is your blood sugar numbers. And again, these are not just specifically about blood sugar control. They cover the entire hormonal spectrum because there's feedback everywhere. Number one, I do not do cortisol levels because cortisol is a short-lived molecule, and it really, just testing cortisol, whether it's saliva, whether it's blood, really has no impact whatsoever in terms of the therapeutic realm. So the cortisol number isn't specific. However, your blood sugars are influenced by cortisol, and I want to know what those are. That's why this is done early morning fasted. So cortisol levels, everyone loves to measure them so they can throw medication at you. Stay away from that as a number, unless there's a specific adrenal issue you're looking for. So the most important number for me I look at is blood sugar, blood glucose, and early morning it should probably be closer to the highest level. Now the cool thing is this. I have a CGM on, which gives me my blood sugar. That's the Dexcom 6. I have that on, which gives me my blood sugar every 5 minutes at night while I'm asleep as soon as I wake up. That's a pretty cool number to have. Most people are not wearing that, so we like to look at blood sugar. And it's blood sugar as opposed to this, which is interstitial sugar. The second set of things I look at is your hemoglobin A1C. So blood sugar tells me what it is right now. A1C tells me what it's been like over the last 6, 9, 12 months. Because that number is based upon glycosylation of red blood cells, and A1C tells me a historical story of what things have been like, and also help me to diagnose correctly type 1, type 2, prediabetes, a variety of other issues with regards to hyperinsulinemia, insulin resistance, and hyperglycemia. The next set of numbers that I look at is C-peptide and insulin. And I always like to look at both of those because what sits between insulin and C-peptide is the liver. How does that work? Well, C-peptide represents the insulin that your pancreas releases. Remember, your pancreas releases insulin into the portal vein, and the liver has a very high first pass effect. About 40 to 60% of the insulin that you produce is used up in the liver. Where are we checking our blood usually? We're checking it in our veins on the other side of the liver. So the C-peptide is a molecule, a precursor molecule, or a piece of the insulin molecule, and then it breaks off, but it stays constant. So your C-peptide level is a useful marker, a predictor of how hard the pancreas is capable of working. And then your insulin number tells us how much of a sponge effect the liver had in terms of using insulin, but it also tells me how dysfunctional your body is, in that it needs insulin to force sugar on the other side of the liver into your blood cells. You see, the liver should control your blood sugar completely. But if it's not functioning properly, then you need insulin on the backside of your liver, beyond your liver, to force the cells of your body to remove that sugar from the bloodstream. And if the cells have been flooded with too much sugar, they shut the front door, they develop they develop insulin resistance. There's another talk on that, but those are the numbers I look at to discover that. And the final number I look at is glucagon. Glucagon tells me, especially early morning, about cortisol, but it also tells me how hard your liver is working to produce sugar for your body. And it also talks about the uncoupling of the insulin-glucagon negative feedback pathway. They should be equal and opposite to each other. And if that system is disconnected and broken, we're also in trouble. So those numbers give me a huge amount of information, and there's one final piece of information that I put into the carbohydrate metabolism pathway. And it's just a simple test. It's not perfect, so don't argue with it, but it's your urinary ketones. Because it gives me a measure, a global, simplistic measure of ketones. I don't need a number, but I need to know whether it's positive or not. Yes, we can check ketones specifically, but I don't do that because, again, it's a moment in time, and the glucagon number gives me that. For my diabetic patients, and in fact, as a standard, I also look at the GAD65 antibody and the insulin antibodies. Those are antibodies that your body in an autoimmune state may produce against your pancreas. And it tells me about LADA, LADA, latent autoimmune diabetes of adulthood, but it tells me also about diabetic status. Very few doctors ever test those. About a third of my type 2s are actually 1s or LADAs. So we've got to test that. Then we look at the lipid profile, and the lipid profile interacts quite heavily with the carbohydrate profile. And what's interesting about the lipid profile is they're all calculated numbers, and the number that I ignore completely, which most doctors obsess about, is total cholesterol. Irrelevant, in my opinion. I don't care. What I look at is the individual numbers, and the most important number for me is your triglyceride count, because that is a direct marker of cardiovascular injury. And it's predictive, most predictive, of your heart attack and stroke risk. The next number I look at is HDL. And then I'll glance at LDL just to make sure it's high enough. Yes, folks, I said high enough. Because a low LDL has a bunch of negative consequences, whether that is statin-induced or you're not eating enough fat. I want a high LDL, which is a paradox compared to what everybody else is telling you. We look at red blood cell folate levels, we look at iron levels, I look at transferrin, I look at iron saturation, and I look at ferritin. Ferritin is not only to do with iron, it's also a marker of inflammation. It's a marker of inflammation. In fact, there's an interesting correlate that if you have COVID and your ferritin levels are very high, that usually predicts a much poorer clinical outcome. So I look at the iron indices, I look at folate, and I look at B12 levels. And they tell me about absorption. They also tell me about your hemoglobin. They give me a global amount of information about uptake. I then look at magnesium and calcium and vitamin D. Calcium tells me about your pituitary function, tells me about your sodium function. Magnesium levels, here's the bizarre part. Everybody's obsessed about magnesium. Magnesium levels are almost always normal, whether you're supplementing or not. I can't remember when last I saw an abnormal magnesium level. Now, we can debate that, discuss that down the road, but again, that's one of the things that I believe has been heavily overhyped. Be that as it may. Vitamin D levels are almost always low. Vitamin D is actually not a vitamin, it's a steroid hormone made in the skin from cholesterol. But it also does get absorbed, and when the production of vitamin D is abnormal, that tells a story. What does everybody do? They throw vitamin D at you. They throw vitamin E. Take this pill. Take your vitamin D levels. There's a whole talk on vitamin D. It's a very popular talk. And yes, it may be important to supplement to begin with. But ultimately, if you don't correct why your vitamin D levels are low and understand that process, you're doing yourself a huge disservice by saying, my lumbar's low, here's a pill for it. It doesn't work that simply, folks. Particularly because vitamin D is has to be activated by the liver and the kidneys to be functional. So vitamin D tells a story, and I don't check vitamins A, E, and K because D is reflective of that. The next thing we look at is thyroid profile. And it's so amazing how many people come in on thyroid medication, and I ask them why, and they say, because my numbers were low, or because my doctor tried to boost my metabolism. Seriously? What's going on? Why? Why? None of them treat why. They treat a number. And they hope that some magical boost will make you so much better, and it doesn't. And you've been stranded on your thyroid medication because once you start, you're on it for life, at least by them. They have no deprescription methodology. So I check free T3, free T4, total T3, total T4, TSH, reverse T3, and most importantly, I always check thyroglobulin antibodies and thyroid peroxidase antibodies because the autoimmune disease called Hashimoto's is so common. We don't check iodine levels, but I have a conversation with you about adding iodine to your diet in one way or another. We then check PT and PTT. Sometimes I forego this, but if you're on a blood thinner, I want to know what those are. And they also speak to two things. They speak to global hepatic function, liver function, and also what's happening in your immunoinflammatory clotting cascade. So those are important numbers for me to look at. Your liver function panel is very, very important because it tells me what level of fatty liver disease you have. If you're a carbohydrate eater, you have a fatty liver, period. But is it also causing inflammation? Is there now damage to the liver called steatohepatitis, inflammation in the liver? And I need to know those numbers. Fatty liver is very, very easily fixed. Very easily fixed. But the inflammatory disease, which is progressive, may not be that easily reversible, if at all. We look at the urine. I'm looking for crystals in the urine. I'm looking for protein and blood in the urine. I'm looking at the urine to give me clues about protein metabolism and about healthy function. Then in females, we test some of the female hormones. I want to know what your DHEA level is, because that's produced by the adrenal glands. I want to know what your FSH, LH, progesterone, and estradiol are. Those are important not only in understanding PCOS or gestational or type 2 diabetes, they're also very important in understanding diseases like lipedema, what your fat distribution is. Are you at risk for visceral fat distribution as a female? Are you protected by global fat distribution, or maybe only in your butt and your hips and your thighs in the lipedema category? I want to know what those numbers are, and your estradiol is the functional estrogen, and so many women are on hormonal replacements. What is that doing? And in particular, the most important of those numbers that I like to look at in a woman is testosterone. Testosterone, because that tells a story. All women produce testosterone. In a man, I'll check testosterone, but I also look at PSA, prostate-specific antigen. Want to know what that is. And then we will look at uric acid. Uric acid gives me a lot of information about protein metabolism, but also about crystals in the kidney, gout function, that type of thing. How is your body working when it comes to the breakdown of amino acids to turn them into sugar or fat? Or are you fat adapted, or are you eating a ton of glucose? The final test I like to get is something called H. pylori. It's a bacteria that lives in the stomach and gives me a great insight into gut health, but also into so many common problems that we see with sterilization of food, that type of thing. And especially if you're on an antacid for reflux or for ulcers, I want to know about that. The other test I like to get, but it's not in my blood work, is your ApoE. ApoE, what's that all about? There's a whole video coming up on ApoE. But knowing what your ApoE 2, 3, or 4 allele distribution is, in my opinion, a very, very important influencer of what you can expect as you grow older, from a cardiovascular perspective as well as from a brain function perspective. But I don't like to put that on the record. I'll discuss it with you, but I like to get the ApoE test done separately because more and more it's going to be manipulated and used against you from a healthcare perspective. Now, there's a whole bunch of other tests that people do. They calculate HOMA-IR, they use CRP, they check homocysteine, you can check ANA, you can check rheumatoid factor, you can check ESR, a whole bunch of other things we can check for. But they don't add up front to my global understanding of where we are with this blood work. They don't add to that understanding. Of course, if I'm looking at a specific issue, I'm going to drill down on that specific issue to figure out what the devil is going on. If you're on particular medications, I want to know what the effect of those medications are, because all medications have side effects. All supplements have side effects. Yep, all supplements have side effects. So I want to know where those numbers are. And then we can discuss how to improve the numbers, what you can do in terms of how you live your life to improve those numbers, or perhaps correct those numbers going forward. And then the only other number that I find incredibly valuable when my patients bring in a series of these is blood pressure. Hypertension, blood pressure, knowing what that is, not in my office, because it's always off in the doctor's office. Not always, but very often. I want to know what your blood pressure is day in and day out. And if you can check that once a day at the same time each day over the course of several days or several weeks, that is very, very valuable information, not just for me, but also for your doctor. But that's what we do in our office. And folks, there's my sheet of paper. If you would like to have that blood work done so that we can discuss the lifestyle conditions that contributed to those numbers, or use it as a badge of honor to say, hey, I'm in great shape. I'm fat adapted, insulin sensitive. Or wow, I didn't know that I had Hashimoto's disease or H. pylori. Some of them need to be treated, but at least know what you're treating and why. So if you're interested in checking out your blood work, whether you've been doing keto carnivore for a long time and are super healthy, or whether you've been new diagnosed with diabetes, or you're obese and you don't know, your doctor says you're so unhealthy, maybe you're not. Some of my fattest patients are actually my healthiest patients. So if you want to figure all of that out and get a different opinion on causation rather than here's a pill for you, or if your doctor is about to prescribe a medication, number one, let's see if you really need it. And number two is let's figure out if you can address why you need to be on it for a while and then deprescribe it. Give us a shout. Text 561-517-0642 and we'll set up a consult. We'll get the blood work done. We'll have a chat about lifestyle. And then we will see how to address those numbers. I hope this helps. I hope this gives you some insight. Most doctors don't even know what to do with some of these numbers because they don't have a pill for it. But it tells a biologic story. Give us a shout. Leave comments down below. Love the comments. And if there's value to these videos, hit the subscribe button. Hit the little bell, the notification on there. Follow me on Instagram at CarbAddictionDoc for little quotes that we put out. But get engaged. See you next time.